The athletic training student positions the patient's hand and thumb in a neutral position or a handshake position. The athletic training student then applies tape adherent to the patient's skin and pre-wrap. The athletic training student anchors a strip of 1-inch non-elastic or 1-inch elastic tape to the medial dorsal surface of the wrist and continues in a medial to lateral direction around the wrist to the MCP joint of the thumb with moderate roll tension. The athletic training student then crosses the MCP joint, encircles the thumb, and anchor on the dorsal surface of the wrist with moderate roll tension. Slightly adduct and flex the thumb while applying the anchor dorsally. The athletic training student then applies 2 to 3 strips of 1-inch non-elastic or 1-inch elastic tape in a medial to lateral pattern with moderate roll tension, overlapping each by 1/4 to 1/2 inch of the tape width in a proximal direction on the thumb. The tape strips should remain proximal to the interphalangeal joint of the thumb. The strips may be applied in an individual or continuous figure-of-8 pattern around the thumb and wrist. Being proximal to the MCP joint, and apply an individual 1-inch non-elastic tape strips with equal tension inward towards the joint. Anchor each strip on the medial and lateral aspect of the thumb. Continue in a distal direction, overlapping by half. Anchor the horizontal strips by placing a 1/2-inch non-elastic strip with mild to moderate tension from the wrist around and under the thumb, finishing on the wrist. The athletic training student then anchors the strips with moderate roll tension around the wrist with 1-inch or 1.5-inch non-elastic tape in a circular pattern. The athletic training student would make sure that the tape job is neat and functional, verbally explain when the taping technique should be documented after its proper fit has been determined. The athletic training student should verbally explain when they should discontinue use.